Autism spectrum disorder is a complex neurodevelopmental process that affects social and communication functioning. In this snapshot, we will be answering the questions, what are the features of autism, and how is ASD diagnosed? I will also take a moment to recognize that although this video will take a brief look at autism spectrum disorder through a medical lens, there are many who disagree with the conceptualization of autism as a medical problem to solve, cure, or treat. Autism encompasses a large spectrum of neurodiverse presentations, and there are many people with traits who function independently, while others need significant assistance throughout their lifespan. This is the general framework I like to use when evaluating any emotional or behavioral concern, starting with evaluating in the context of normal behavior that does not result in significant distress or functional impairment. Then medical causes for the symptoms. Then effects of substances and medications. And then other psychiatric disorders then account for the symptoms. Of the psychiatric disorders, some have identifiable symptom onset and occur in episodes. And others, like the neurodevelopmental disorders, have features that are enduring and more difficult to pinpoint in their onset. Autism spectrum disorder is one of several neurodevelopmental disorders. Neurodevelopmental disorders are enduring processes that affect brain development and functioning and begin in childhood. You'll notice that autism is different from intellectual disability, and although the two can co-occur, they are not the same thing. We will talk about other neurodevelopmental disorders in separate videos. Autism can be diagnosed at any age, but symptoms start in early childhood, often by age 2 or 3. Some features may not become fully apparent until later life demands outweigh the individual's inherent ability to meet those demands. Features of autism are grouped into two major categories: difficulties with social interactions and communication, and patterns of restricted interests or repetitive behaviors. To meet criteria for an autism diagnosis, a person needs persistent deficits in reciprocity, nonverbal communication, and making, maintaining, and understanding relationships. Examples of social emotional reciprocity include struggling with starting or maintaining back and forth conversations, sharing emotions or interests, or starting or responding to social interactions. Some people with ASD may dominate conversations instead of taking turns talking and listening. Some people may struggle to understand and express feelings. Others may not know how to initiate age-appropriate socializing. There are several examples of nonverbal communication difficulties, including unusual eye contact, unusual body language, misunderstanding gestures, and limited use of expressive gestures or speech prosody to convey emphasis or meaning. People with autism may have difficulty picking up on when others are joking or being sarcastic, or other nonverbal cues that are readily apparent to others that can help them pick up on the emotional tenor of a situation. Additionally, individuals with ASD have difficulty making, maintaining, and understanding relationships. Some people may have little or no interest in others, while others may very much want to make friends, but may eventually experience repeated social rejection or even bullying by others because of difficulty with social skills, such as being possessive, having rigid rules or expectations about social relationships, struggling to adjust their behaviors to different situations, or understanding the perspective of others. Girls with autism are particularly at risk of being misconceptualized as having social anxiety disorder or borderline or histrionic personality disorder because of difficulty with social interactions. Again, these are all just some examples and are not all encompassing. Additionally, 2 more symptoms of restricted or repetitive interests or behaviors are needed to make a diagnosis of autism. Categories include stereotyped or repetitive motor movements, use of objects, or speech. Examples can include lining up toys, being interested in parts of objects like spinning the wheels of a car instead of using a car the way it was intended as a toy, motor stereotypes like hand flapping or spinning when excited or upset, echolalia, which is the repeating of words or phrases, or just using phrases from movies or TV shows to communicate rather than using spontaneous speech. Insistence on sameness, inflexible adherence to routines or ritualized patterns of verbal or nonverbal behavior. People with autism may feel extreme distress at when plans change unexpectedly, difficulties with transitions, have rigid thinking patterns, use stereotyped greeting rituals, or need to take the same route or eat the same food every day. Highly restricted, fixated interests that are abnormal in intensity or focus, including strong preoccupation with unusual objects and excessively focused or perseverative interests. The fixation can become such that it interferes with their ability to engage in other areas of life or makes socializing difficult when their level of interest is not shared by others. An example I'm showing here is dinosaurs. Lots of kids like dinosaurs, but a child with autism might know every single fact about them and only want to talk about and play with dinosaurs to the point where other kids might move on to something else in conversation. The last is hyper or hyporeactivity to sensory input or unusual interest in sensory aspects of the environment. Examples include being unbothered completely by pain or temperature, or on the opposite end, getting distressed by certain noises or textures, such as tags on clothing or certain foods, needing to constantly smell or touch things, or unusual fascinations with lights or movement. Since autism is a neurodevelopmental process, it's important to be able to familiarize yourself with typical developmental milestones so that you can identify when a child may be experiencing a deviation or regression from their baseline. This chart is adapted from the American Academy of Pediatrics Brighter Futures website. The American Academy of Child and Adolescent Psychiatry recommends evaluation for autism spectrum disorder if any early social communication concerns are present, including not smiling by 6 months, not responding when their name is called, no back and forth sharing of sounds, smiles, and facial expressions by 9 months, not babbling, pointing, reaching, or waving by 12 months, no single words by 16 months, no spontaneous 2-word phrases by 2 years, and spontaneous here means putting 2 words together to make a sentence. Thank you would not be a 2-word phrase because it's a common phrase that's almost its own word. Put down is a spontaneous 2-word phrase. And any regression in milestones, loss of speech, babbling, or social skills. In the primary care setting, if a child is otherwise developing as expected, the American Academy of Pediatrics recommends universal screening for autism at ages 18 and 24 months. Although there are many screening tools, the Modified Checklist for Autism in Toddlers Revised with Follow-Up, or MCHAT, is commonly used. If the screen is positive, discuss the results with parents, check developmental milestones in clinic, and obtain a hearing test, especially if one hasn't been done recently. Ensure thorough review of newborn screen, medical history, and complete physical and neurological exam. There are no genetic or other medical tests to make an autism diagnosis, but genetic testing can be done after a diagnosis of autism is made, as a genetic cause can be identified about 30 to 40% of the time. Autism is a clinical diagnosis, but referral can be made for further evaluation and confirmation. A combination of validated observational testing, such as the gold standard Autism Diagnostic Observational Scale, or ADOS, and questionnaires, such as the Social Responsiveness Scale and Social Communication Questionnaire, is often used. Children can be referred for genetics consultation and testing as indicated. Referrals for treatment should be targeted towards the child and family's needs and treatment goals. There is no cure for autism, but there are many options for skill building and to support communication and social skills development. To summarize, autism spectrum disorder is a neurodevelopmental disorder characterized by a pattern of long-standing difficulties in social interactions, communication, and restrictive and repetitive behaviors and routines. Symptoms start in early childhood, typically by age 3. Speech delay isn't needed for diagnosis, and although communication deficits are present for diagnosis, it's not limited just to spoken language. The AAP recommends routine screening at the 18 and 24-month well child visits. There is no medical laboratory test to diagnose autism. Psychological testing, such as the gold standard ADOS, confirms suspected clinical diagnosis. Genetic testing can be done after confirmed diagnosis to evaluate for possible genetic causes of autism.